I'm Dr. Nichelle Haynes.
I'm Dr. Kristen Lassiter.
And we're Medical Mamas. This is your place to get evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like pregnancy, postpartum, menopause, around your menstrual cycle, and fertility.
Today we're going to be talking about a really important topic. We're going to be talking about when to consider stopping your antidepressant after postpartum depression.
So there's oftentimes this myth that once you start an antidepressant for postpartum depression or perinatal depression, then you have to be on an antidepressant for the rest of your life. And that's one of people's biggest concerns, I think, with starting antidepressants is, well, how long do I have to take it forever then?
First off, you don't have to do anything.
No. Yeah, if a doctor's making you do something, that's against your patient autonomy, so that's not good.
This should be always a discussion about risk-benefit. What are your options? How does that look? Those kinds of things. So when you're talking about medications, an important thing to do is talk about what happens down the road. How long do I anticipate being on this?
Yeah. And for a lot of women, and men, it becomes this treatment for them where they realize, wow, I feel so much better. I didn't realize how anxious I was, or I didn't realize like how irritable I was, and my, family's happier and I'm happier. And so it might be their own decision to stay on the medication longer or even for the rest of their life, and that's okay too.
I would say that's the most common experience that I have with my patients, is that the anxiety or depression that they had pre-perinatal was like either missed or overlooked or just seen as not like that big of a problem.
Or they thought it was normal, like that's how they've lived their life. And then they get treated and they're like, oh my God.
Oh wow, I did not realize how difficult things were for me, and they don't need to be like that. People choose like, oh, I'm just so much happier. I feel so much better that like I don't want to change a thing.
So I think it's important to discuss how antidepressants work before we kind of discuss how long or when you should stop an antidepressant after postpartum depression. So antidepressants basically are working on a biochemical level on your neurons or brain cells to help them work and function better. And it's working to heal your brain cells. So basically, it creates these different chemicals that help your natural chemicals can be natural, chemicals that help your brain cells grow and make new connections with other brain cells so that your thoughts, emotions, behaviors can kind of get back to how your brain is supposed to be functioning.
When you're depressed and you have consistent thoughts that are like maybe negative, so like maybe the thought is like, oh, I'm a bad mom or something, that your neurons fire that pathway and they like to be efficient, right? So they create very well enmeshed connections with each other so that pathway is like very easy to use because it realizes we're using that pathway a lot. Let's make it easy to use that pathway.
So and it strengthens those connections.
Right, and they become like real like together, right? Yeah. So I imagine it like a hiking path, right? So you've been down a path that like everyone's used before, right? The ground is easy to walk on. There's not a whole lot of stuff going on. There's like nothing coming across the path, right? So your thought like I'm a bad mom essentially became that well-worn hiking path. And so when you start to transition over to a new path that's like, hey, I'm actually a great mom, that one is like wild woods, right? So you have to like hack through the trees. You have to like wear the ground down. You have to move some rocks out of the way. So it just takes time for those neurons to do that thing, just similar to how a hiking path would do. So that's why we don't recommend taking your medications inconsistently, because you're not consistently helping those neurons create the connection. Same as the hiking path. You're gonna let it grow over again and then redo all of that work. No, you gotta like keep working at it every day consistently.
And that's where the medication helps. It kind of helps them make those chemicals and those neurotransmitters that they need to form those healthy connections.
Yeah.
And our brain is complex, right? It's probably one of the most complex organs that we have in our body, and so it takes a lot of time for our brain cells to form new connections and to heal.
Right.
So once you're healthy, once your brain is back to functioning how it should be functioning, that's when the clock starts of how long should you be taking the antidepressant.
The evidence-based answer here is 9 months to a year.
Yeah, so the start time being once you're feeling healthy, your brain's working back to normal, that starts the clock, and then 9 months of you feeling healthy and normal is the minimum time that you should be on an antidepressant. So in those 9 months to a year, your brain is kind of solidifying the foundation of being healthy so that when you decide to come off, if you decide to come off the medication, it has that solid foundation, and stressors or other, hormone changes or other things that go on in our brain that can kind of disrupt the way it's functioning can't do it so easily because you've taken the medication for a good amount of time and you've let your brain really fully heal.
Okay, it's been the 9 months, it's been a year, maybe it's been whatever period of time, and they decide like, okay, we want to have this conversation. What things should people consider?
So first of all, it should definitely be a conversation with your psychiatrist, because there's things you have to consider, like how many times have you been depressed before? How many episodes of depression have you had before? The more episodes of depression you have, kind of like Dr. Haynes was talking about with these pathways, the more your brain kind of can fall back into those patterns. And so if you've had 3 episodes of depression before, it's almost guaranteed that you're going to have another episode of depression later on in life. And so is it worth coming off the medication? How severe are your depression episodes? How much do they disrupt your life or disrupt your family? Maybe it's not worth coming off the medication yet.
So we look at history, really important, current situation, and then even future situation. Are we looking at huge, big stressors coming up in the next, couple of months as you're planning to taper off? If you're planning a move, if you're planning to have another child, if you're planning to change your career, or there's big stressors coming up, there's lots of things to consider. You just want to look at the big picture.
Right, because when we have big stressors like that, that creates higher cortisol levels, which then impact the way that those cells are connecting and functioning again. So it's not like, oh, am I strong enough to handle this move or this new job? It's more like this is a big change in our body on a biological level. Does things to adjust to that change.
Stressed out.
Yeah, get stressed.
We get stressed. So
It's
we just want to look at the stressors and consider those things. Like maybe we just get through those stressors and then consider getting off of medication. Another thing you want to look at is, are you planning to expand your family? If you, for instance, are free of symptoms all of the time except when you're pregnant or postpartum, would it be really worth it to get off of medications for a short period of time, risk relapse of symptoms, then try and know that your risk is pretty high during those times too? So we look at the big picture. We don't want to just say like it's always 9 months or always a year, or you have to, or you don't have to, or you shouldn't, or you have, those sorts of things. We don't do that.
Yeah.
It's always very personalized what you should do. So definitely talk to your doctor about what it looks like for you. I also want to talk about, why do you want to get off of medicine? Why do you want to be on medicine?
A lot of times it's, I don't want to be on medication because that means I'm weak. Or we kind of have like this cultural idea of what it means to be on psychiatric medications, or all these stigmas in our culture. But those are biases, right? Those are not facts. They're not reality or truth. And so really being able to kind of talk with your doctor about what are your fears, what are the concerns you have, what's the stigma that's behind maybe your bias of wanting to get off or maybe wanting to stay on the medication, and is that based on reality and facts and evidence, or is that more based on kind of our cultural biases?
Mm-hmm. Gosh, it's just so heartbreaking to hear people say, yeah, I feel better, but like I don't want people to know I'm on medicine, I just don't want to be on medicine because like that makes me weak or whatever.
Or my family thinks it's bad for me, or they're worried it's gonna like cause some issue. Like, talk to your doctor about what are the risks of staying on the medication long term, and weighing those against the risks of stopping it. And our brain is an organ, like we talked about, and so just like other organs in our body, we can have disorders or illnesses that affect our brain that we can't control. And so even if you do all the things right, like therapy, eating healthy, exercising, sleeping well, doing all the things perfectly, sometimes it's still not enough, and your brain is just more likely to fall back into this illness, and that doesn't mean anything about you.
No. It's like someone has high blood pressure. Yeah, they can cut back their salt, they can reduce their caffeine, they can work on their alcohol consumption, they can sleep, they can exercise, they can do all of these things and still have high blood pressure, and no one's like, ooh, look at you.
You're weak.
Ooh, high blood pressure.
Why don't you be stronger and adjust your blood pressure?
Yeah.
You can't make yourself not depressed or not anxious.
Right, you can work on it and like, yeah, you can do your breathing and slow your heart rate, but you can't just like, it's not a machine. It's not a machine. It's a body. So, oh yeah, that would be kind of fun.
Yeah.
Okay, so the answer is really 9 months to a year of feeling well. Then have the discussion. And of course, there are caveats there, right? Like if medicine's giving you really big problems, maybe we switch medicines.
Or if it's making you feel really numbed out, like you're not able to feel happy or sad or excited or whatever, like that's a side effect, and so that's something we don't want either. The medication's supposed to make you feel like you're back to normal. It's supposed to make you feel like things are easier. It's not going to take away stressors or hard parts of life either, but those things are easier to deal with when you're on medication. And if you do decide to stop medication, another thing to add is then it's really important to slowly taper it. So it's very rare that you should just suddenly stop.
It's very nuanced. It's very nuanced. So make sure you're having the discussions about why and what are the risks and the benefits. Okay, thank you for being here today. We really hope that this information was helpful to you. Please like the video, comment, subscribe to our channel. We'll see you soon.
Bye.